Well, in Walkerton, Ontario, hundreds of people we saw lined up for a chance at getting a family doctor.
Got here about 5:30 and been on the Healthcare Connect list for about 10 years now. Haven't had a doctor for longer than that, so kind of a strange way to have people sign up for a doctor, but hopefully I get one.
Well, that's just one sign of our broken healthcare system. Here's another. New data shows an alarming number of Canadians are dying before they can get the health care that they need. A new report from secondstreet.org shows that more than 15,000 people died in Canada between 2023 and 2024 because they were waiting for treatment or a diagnosis. For a closer look at what's behind these numbers, we're joined by Harrison Fleming. He's a policy director at secondstreet.org. Thanks for coming on the show this morning.
Hey, thanks so much for having me on.
Boy, Harrison, I remember a couple of years ago, there was this open letter signed by doctors that said, people are going to start dying if we don't get a hold of what's happening in the healthcare system. And here we are with the results from your report. What do the numbers tell us specifically?
Well, actually, it's important to point off right off the top here that these numbers are actually incomplete. We collect this data through freedom of information requests to governments. And unfortunately, we're at the mercy of those governments responding to those requests to get this data. And so, unfortunately, Quebec, Newfoundland, Labrador, most of Manitoba, and for the first time in 5 years, Alberta, did not provide us data on this report. And so when we look at that number and we extrapolate it across those provinces that haven't provided us data, we estimate the real number to actually be about 28,000 people.
All right. So I'm glad that you gave us the explainer about who did have data in this and who does not. But it does show that patients from the places that you did gather and were able to through FOIs, that patients died while waiting anywhere from less than a week to more than 14 years. So what kinds of treatments and diagnoses have the longest waiting lists?
Well, it's actually a pretty even split across different levels of care. The Fraser Institute just put out a report at the end of last year showing the average wait time for health services in Canada is actually more than 30 weeks, which is over half a year. And when we're looking at what this means across the country, it means that people are getting delays on cancer diagnoses, cancer treatment, heart surgeries, major operations that are impacting their lives. And we also know that other health ailments like hip and knee replacements, cataract surgery, these are also being left by the wayside. We're seeing thousands of Canadians waiting for upwards of 18 months to 2 years for some of these procedures that are really impacting their quality of life and actually maybe even putting their life at risk.
You know, we know that healthcare is a provincial requirement, falls under their jurisdiction, but increasingly, and even more so since the pandemic, the federal government has been involved in some of these decisions. Why isn't it required that all government healthcare bodies track waitlist deaths?
You know what? I would actually love to know that myself. It's a real challenge that we are left at sort of the mercy of these FOIs because there is no government in the country that is actually proactively disclosing this information. And in fact, governments are actually getting worse at it, not better, as we see a province like Alberta, which previously would give us data, now has not. And so why they're not doing that, I don't understand, especially when we're looking at, for example, if I own a restaurant and my restaurant was to fail a health exam, in Toronto, a sticker is put right on my window that says I failed that exam, and the public knows because my health and safety may be at risk as a customer if I was to go in there. And yet our healthcare system doesn't have those same parameters. If people are literally waiting for hours in ERs before they pass away, or if they're passing away before they get care for something as serious as cancer, why isn't there any obligation for the government to tell us, the people who are paying for this service with our tax dollars? I really would love to know why there isn't more pressure to put this information out publicly.
I'm sure that you and your colleagues at Second Street are pushing for more of those answers. Harrison Fleming, Policy Director for Second Street, good to have you with us this morning.
Thank you so much.
If you liked that video, make sure to subscribe to the Your Morning YouTube feed where you can find all kinds of new content posted every weekday morning.